Hi, my name is Roger Bannister, and today we're going to look at using kinesiology taping using Rocktape. And what we're going to do is tape to prevent an impingement syndrome of the shoulder. If you've got anterior lateral shoulder pain coming from the supraspinatus or the bursa, or even slightly posterior with the infraspinatus is being caught, then this technique could help reduce part of the symptoms. What we're going to do first of all is apply the tape anterior to the shoulder to the mid-scapula and take that measurement and then cut that tape. You're going to round the ends by cutting the corners. So that means we have a prepared eye strip. First of all, what I'm going to get Nick to do is sit tall, externally rotate the humerus, and then retract a little bit so we lengthen part of the pectoralis muscle. Split the tape, try not to contact the end, and apply the end of the tape around the anterior humerus, like that. And then what I'm going to do is lock that down and apply around 50 to 75% stretch, crossing the infraspinatus, and no stretch at the end, so just feed that out. And that's part one done. I'm also going to use the tape to deactivate the trapezius. Just relax that elbow for a sec. So I'm going to take that rough measurement, because there's going to be a bit of stretch on that, to the lower trapezius. And again, I'm going to round these ends. So just apply one piece of tape over the other, and then just trim those corners. So that will be the size of this one. Split the end, so the first inch or so, peel that back, and then lay that down over the insertion of the trapezius onto the clavicular attachment. And this one, relax that. I want you just to retract the shoulders and just hold that position there. Lock it down, pull it, 50 to 75% tension. It comes down to that lower trapezius insertion. The idea behind that now is, when he is reaching forward, he feels pre-tension of the tape. When he is lifting his arm up, because what tends to happen is the upper traps tends to work too much for the shoulder, especially if you have pain. So you have what we call a reverse scapulohumeral. So by trying to deactivate the trapezius a little bit, and by trying to stabilize the external rotation, it makes the patient aware of the shoulder, and then hopefully reduce their symptoms. If you're interested in how to learn how to tape, then look on www.johngibbonsbodymaster.co.uk.